Okay, let's start to talk about CML. All right, we're gonna go and start to talk about CML. All right, this is gonna be the second video in the CML series. All right, out here we're gonna go and talk about the phases of CML first of all. All right, so if you look at the phases of CML, we have a chronic phase, we have an accelerated phase, and we have a blast crisis. How do we differentiate between these phases, right? So essentially, what's happening in the chronic phase is that the blast count, all right, in the peripheral smear is less than 10%. All right, if it goes from 10% to 19%, that is known as an accelerated phase, and once it reaches more than 20%, all right, that is known as blast crisis. All right, so this is something that we have already seen in sorry, AML, right? A, acute myeloid leukemia, right? Acute myeloblastic leukemia, right? So that's what it is, right? So initially it is be 10 less than 10%, all right. So in the chronic phase, 10 to 19% would be the accelerated phase, and more than 20% is going to be the blast crisis. All right, now the accelerated phase. All right, diagnosis in the accelerated phase is quite important, because in the chronic phase you're going to be asymptomatic, you won't have that many symptoms, and it's okay. All right, we don't really have to do anything about the chronic phase. Blast crises are pretty much dead on the right. So out here you need to basically, what you need to do is like try to look up coffins. All right, so that's what you need to do. Right, in the accelerated phase though, maybe there's something we can do. Maybe we can go and start treatment. All right, for that we have some diagnostic criteria. What are the diagnostic criteria? All right, the blasts, all right, they have to be 10 to 19%. All right, so we already mentioned that, but then blasts have to be 10 to 19%, either in the peripheral blood or in the blood, in the bone marrow aspirate. All right, bone marrow aspirate or the peripheral blood. All right, blasts have to be 10 to 19%. All right, there should be basophils, more than 20% basophils should be there. All right, but then seeing a couple basophils is also enough. All right, so more than 20% basophils should be there, but in the peripheral smear, obviously, in the peripheral smear, more than 20% basophils should be there, all right? There should be thrombocytopenia or thrombocytosis, all right? So thrombocytopenia or thrombocytosis, all right, which should be persistent, all right, which should be unrelated to therapy. Any sort of therapy that you're going to be giving, all right, unrelated to therapy, all right? It should be thrombocytopenia or thrombocytosis, all right? Along with that, the spleen should be enlarged, all right, and there should be a lot more WBCs, all right, which is also unresponsive to therapy, all right? There should also be cytogenetic evidence of clonal what is it, evolution, all right, of clonal evolution. So all of these things are going to be there, all right. So what are the diagnostic criteria for the oh, okay, all right, thank you. So accelerated phase, all right. So what happens in the accelerated phase is that the blast count is going to be about 10 to 19%, all right. That's one of the diagnostic criteria. Basophil is going to be more than 20%, all right. Thrombocytopenia, thrombocytosis, unresponsive to therapy and unrelated to therapy, all right. You can have increase in the spleen size and increase in the WBCs, all right. And there's also cytogenetic evidence of clonal evolution, all right. So all of these things are going to be there in the accelerated phase, all right. So we looked at the chronic phase, we looked at the accelerated phase, we looked at the blast crisis, all right. So what do we need to do in the chronic phase? Nothing. What do we need to know in the blast crisis? Try to look for a coffin or whatever. However, you're gonna burn your man, throw him off a cliff. I don't know, all right. But then you gotta start digging in his grave, is all I'm saying. Right. So in the accelerated phase, we need to make a diagnosis. So 10 to 19% blasts are gonna be there, more than 20% basophils, spleen size enlarges, thrombocytosis, thrombocytopenia, right? Cytogenetic evidence is supposed to be there. There's supposed to be increase in the WBCs, all right, so on and so forth. All of these diagnostic criteria, they have to be fulfilled, all right, in order to kind of diagnose someone with the accelerated phase, all right. What happens, what would you expect in the labs, all right? In the labs, what would you expect? So it's a myeloid neoplasm, so hemoglobin should increase, right? And total leukocyte count, all right, it should also increase, and platelet count should also increase. But then one thing that we do notice, right, is that the hemoglobin does not increase. For some reason, the erythroid series does not increase, all right. Only the lymphoid, not the lymphoid, I mean the granulocyte series and the megakaryocyte series, all right, they are going to go and increase, all right. So hemoglobin is going to be low or normal, all right. So it's going to be normal or low, all right, because of no effect on the erythroid series, all right. I'm getting it. Now we're going to go and look at the peripheral smear. In the peripheral smear, we're going to go and see these two, all right. So what is this? This looks like bone marrow to me, right? But this is actually the peripheral smear, all right. This is actually the peripheral smear. So the peripheral smear has a bone marrow like appearance, all right, because of release of immature cells. Immature cells have been released into the blood, all right. So that's why in the peripheral smear we have a bone marrow sort of an appearance, all right. Another kind of appearance that we have is be a college girl or garden party appearance, all right. A college girl or garden party appearance. Why is that? So why do we call it a college girl or garden party appearance? Because outer, look, this is a myeloblast. Okay, what is this? This is going to be, I think this is a myelocyte. So this is a myelocyte, all right, and this is going to be a metamyelocyte. You see, All right, so we have all forms of myeloid maturation. All right, all stages of myeloid maturation are present. All right, that's why we call it a college girl appearance. What I want you to contrast it with is going to be CLL. All right, in CLL we actually have a convent girl appearance. All right, so they all look the same. Only out here we have so many different ones. That's why it's called college girl appearance. All right, so that's what we have. Okay. Next, if you look at the bone marrow aspirate, all right, the myeloid erythroid ratio is going to be absolutely messed up, all right. Myeloid erythroid ratio is usually supposed to be 3:1 to 15:1. We consider that to be normal, but now it's going to be raised very high, all right. It's going to be very, very, very high, all right. Along with that, what happens to the megakaryocytes? The megakaryocytes become dwarfs, all right. So you get dwarf megakaryocytes, all right. What happens to the macrophages? You get these sea blue macrophages or histiocytes. All right, sea blue histiocytes, macrophages are going to be seen, and you see these pseudo Gaucher cells. All right, what are these pseudo Gaucher cells? All right, these pseudo Gaucher cells are basically with these like they have the cytoplasm which is going to be like wrinkled tissue paper, right? So they have the cytoplasm which is going to be wrinkled tissue paper. Okay, so what do we see in the bone marrow aspirate? In the bone marrow aspirate, you're going to go and see that the myeloid erythroid ratio is going to be raised or significantly. You're going to see dwarf megakaryocytes, you're going to go and see sea blue histiocytes, you're going to go and see pseudo Gaucher cells. All right, so that is what you're going to go and see in the bone marrow aspirate. All right, the peripheral smear is going to be looking like a bone marrow aspirate because of the release of immature cells into the circulation. All right, and you get a college girl appearance, all right, in the peripheral smear because of different stages of myeloid maturation. All right, so that is going to be everything. Do remember that the erythroid series is not affected. All right, so it is either going to be low or normal. TLC and platelet count are both going to go and increase. The chronic phase has less than 10% blast, 10 to 19% blast is going to be the accelerated phase. Blast crisis is very undead, so 20% or more. All right. So diagnostic criteria: blasts have to be 10 to 19%, basophils have to be more than 20%, thrombocytopenia or thrombocytosis should be the unrelated therapy, increase in the spleen size, increase in WBCs, all right. Cytogenic evidence of clonal evolution should also be there. That is going to be everything for CML part 2. I'll see you in CML part 3.